Question 1. A patient with a known history of severe latex allergy is scheduled for an office procedure. Which of the following is the most critical immediate action for the medical assistant to take when setting up the exam room? A. Ensure all instruments are sterilized using a high-level disinfectant. B. Double-check the patient's insurance information before the procedure. C. Verify that all supplies, including gloves, are latex-free and clearly labeled. D. Prepare an emergency cart with epinephrine and antihistamines at the bedside. Answer: C. Verify that all supplies, including gloves, are latex-free and clearly labeled. This question tests the crucial concept of patient safety, specifically concerning severe allergies. The keyword "most critical immediate action" emphasizes proactive prevention. Ensuring all supplies are latex-free prevents exposure and a potentially life-threatening anaphylactic reaction, which is paramount over other necessary but less immediate steps. While having an emergency cart ready is important for response, the primary goal is to prevent the allergic reaction entirely by meticulously checking all materials. For example, a medical assistant must confirm that all bandages, wraps, and even syringe plungers are free of latex. Remember, prevention is always the best medicine, especially with severe allergies. Question 2. A medical assistant is performing an EKG on a patient who suddenly becomes unresponsive and pulseless. What is the immediate and most appropriate action the medical assistant should take? A. Continue monitoring the EKG to identify the cardiac rhythm. B. Call for help and immediately begin chest compressions. C. Retrieve the automated external defibrillator, AED, first. D. Administer oxygen and elevate the patient's legs. Answer: B. Call for help and immediately begin chest compressions. This question evaluates the medical assistant's response to a critical emergency, specifically cardiac arrest. The keywords unresponsive and pulseless clearly indicate a life-threatening situation requiring immediate cardiopulmonary resuscitation, CPR. According to basic life support protocols, the most appropriate first action is to call for help and initiate chest compressions without delay to maintain blood flow to vital organs. While an AED is crucial, starting compressions is prioritized to minimize time without circulation, and further EKG monitoring or administering oxygen would delay essential life-saving measures. Always remember to initiate chest compressions immediately once unresponsiveness and pulselessness are confirmed, as every second counts. Question 3. A medical assistant is preparing to irrigate a patient's ear. Which of the following conditions is a contraindication for ear irrigation? A. Excessive cerumen impaction. B. Sensation of fullness in the ear. C. Tympanic membrane perforation. D. Mild otitis externa. Answer: C. Tympanic membrane perforation. This question assesses knowledge of safety protocols and contraindications for common clinical procedures. The keyword contraindication indicates a condition that makes a particular treatment or procedure inadvisable due to the potential for harm. Irrigating an ear with a perforated tympanic membrane, also known as a ruptured eardrum, can introduce fluid into the middle ear, leading to infection or further damage. While cerumen impaction or a feeling of fullness are common reasons for irrigation, and mild otitis externa might require caution, a perforated eardrum is an absolute contraindication. Always confirm the integrity of the tympanic membrane before performing an ear irrigation to prevent serious complications. Question 4. A patient has a new order for warfarin, Coumadin, therapy. Which of the following laboratory tests will the medical assistant inform the patient will be used to monitor the effectiveness of this medication? A. Complete blood count, CBC. B. Basic metabolic panel, BMP. C. Prothrombin time, PT/INR. D. Liver function tests, LFTs. Answer, C. Prothrombin time, PT/INR. This question tests the understanding of common anticoagulant medications and their specific monitoring requirements. The medication warfarin, also known as Coumadin, is an anticoagulant that prevents blood clot formation, and its effectiveness is precisely measured by how long it takes for blood to clot. The prothrombin time, PT, and its standardized form, the International Normalized Ratio, INR, are the specific tests used to assess the clotting factors affected by warfarin. A CBC measures blood cells, a BMP assesses electrolytes and kidney function, and LFTs evaluate liver health, none of which directly monitor warfarin's anticoagulant effect. Always remember that warfarin requires strict PT/INR monitoring to ensure the dosage is safe and therapeutic. Question 5. A medical assistant is attempting to collect a blood sample from a patient, but after 2 attempts, is unable to obtain a sufficient sample. Which of the following is the most appropriate action for the medical assistant to take next? A. Ask a colleague to attempt the venipuncture. B. Attempt a third venipuncture at a different site. C. Inform the patient that the sample cannot be obtained today. D. Document the failed attempts and cancel the order. Answer, A. Ask a colleague to attempt the venipuncture. This question assesses professional judgment and adherence to safety protocols during a common procedure. The keyword most appropriate action implies choosing the best course of action that prioritizes patient comfort and successful specimen collection. After 2 unsuccessful venipuncture attempts, it is standard practice and patient-centered care to ask a more experienced colleague to try, as this minimizes patient discomfort and improves the likelihood of obtaining the sample. Attempting a third stick by the same person is generally discouraged due to increased risk of patient discomfort and tissue damage, while canceling the order without further effort is not ideal if the sample is medically necessary. It's always best to involve another qualified professional before giving up on a necessary blood draw. Question 6. When performing a capillary puncture on an infant, which of the following is the most appropriate site to use? A. The central arch of the foot. B. The tip of the great toe. C. The lateral plantar surface of the heel. D. The palmar surface of the index finger. Answer, C. The lateral plantar surface of the heel. This question tests precise knowledge of anatomical sites for specific procedures in different patient populations. The keyword infant is critical here, as appropriate puncture sites vary significantly with age to ensure safety and adequate blood flow. For infants, the lateral plantar surface, outer edge, of the heel is the recommended site for capillary puncture because it has a thick stratum corneum, good blood flow, and avoids major nerves and blood vessels. Other sites mentioned, like the tip of a toe or finger, are generally too small or risk bone damage in infants. Always remember to use the lateral aspect of the heel for infants to prevent injury and ensure proper blood collection. Question 7. A medical assistant is administering an intramuscular injection to an adult patient. Which needle gauge and length combination is typically appropriate for a vastus lateralis injection? A. 25 gauge, 5/8 inch needle. B. 21 gauge, 1 inch needle. C. 23 gauge, 1.5 inch needle. D. 18 gauge, 1 inch needle. Answer, B. 21 gauge, 1 inch needle. This question assesses detailed knowledge of injection techniques, specifically regarding needle selection for a particular muscle and patient. The vastus lateralis is a large muscle in the thigh often used for intramuscular injections in adults, particularly when deltoid access is limited or larger volumes are needed. For adult intramuscular injections into a large muscle like the vastus lateralis, a 21 gauge, 1 inch needle is typically appropriate to reach the muscle tissue effectively while minimizing discomfort. A 5/8 inch needle is usually for subcutaneous injections or very small, thin individuals, and a 1.5-inch needle might be too long for many adults, while an 18-gauge is generally too large for routine IM injections. Always choose the needle gauge and length that ensures the medication reaches the intended muscle depth without causing unnecessary pain or complications. Question 8. A medical assistant is documenting a patient's vital signs and notes an irregular pulse. Which of the following is the most appropriate method to accurately assess an irregular pulse? A. Count the pulse for 15 seconds and multiply by 4. B. Count the pulse for 30 seconds and multiply by 2. C. Count the pulse for a full 60 seconds. D. Count the pulse at both the radial and apical sites simultaneously. Answer: C. Count the pulse for a full 60 seconds. This question tests the precision required in vital sign assessment, particularly for abnormalities. The keyword irregular pulse is the crucial clue, indicating that a standard short count will not provide an accurate heart rate or rhythm assessment. When a pulse is irregular, counting for a full 60 seconds allows the medical assistant to identify the true average rate and observe the pattern of irregularity more accurately. Shorter counts might miss skipped beats or clusters, leading to an underestimation or overestimation of the actual heart rate. While comparing radial and apical pulses can be informative for a pulse deficit, the primary method for assessing an irregular pulse's rate is a full 60-second count. Always take the time to count for a full minute when encountering an irregular pulse to ensure an accurate and reliable reading. Question 9. A medical assistant is reviewing a patient's medication list and notices an order for a medication to be administered sublingually. How should the medical assistant instruct the patient to take this medication? A. Swallow the pill whole with water. B. Place the tablet under the tongue. C. Chew the tablet thoroughly before swallowing. D. Dissolve the tablet in a glass of water and drink it. Answer: B. Place the tablet under the tongue. This question assesses knowledge of medication administration routes and patient education. The term sublingually is a key medical abbreviation indicating the specific route of administration. Sublingual refers to administering medication by placing it under the tongue, where it dissolves and is absorbed directly into the bloodstream through the mucous membranes. This route bypasses the digestive system and liver, leading to a faster onset of action. Swallowing or chewing would alter the intended absorption and effectiveness of a sublingual medication. It's vital to educate patients precisely on how to take their medications for optimal therapeutic effect. Question 10. A medical assistant is scheduling a patient for a colonoscopy. Which of the following instructions is most critical for the medical assistant to provide to the patient regarding preparation? A. You will need to be NPO, nothing by mouth, for 8 hours before the procedure. B. You must complete a bowel preparation regimen the day before the procedure. C. Arrange for someone to drive you home after the procedure. D. Bring a list of all your current medications with you. Answer: B. You must complete a bowel preparation regimen the day before the procedure. This question focuses on essential patient education for a specific diagnostic procedure. The keyword "most critical" highlights the instruction without which the procedure often cannot be performed or will yield poor results. For a colonoscopy, thorough bowel preparation is absolutely essential to clear the colon of fecal matter, allowing the physician to visualize the bowel lining effectively. While NPO status, a ride home, and medication lists are all important, failure to complete the bowel prep leads to rescheduling the procedure or an incomplete examination. Always prioritize instructions that directly impact the success of the diagnostic procedure. Question 11. A medical assistant observes a colleague documenting patient information in an electronic health record, EHR, while logged in under another medical assistant's credentials. What is the most appropriate action for the observing medical assistant to take? A. Ignore the situation as it does not directly involve them. B. report the incident to a supervisor or the office manager. C. Remind the colleague to log out and log back in under their own credentials. D. Offer to help the colleague with their documentation to speed up the process. Answer B. Report the incident to a supervisor or the office manager. This question tests ethical conduct, patient privacy, and professional responsibility within a healthcare setting. Using another person's login credentials to document in an EHR is a serious breach of security, confidentiality, HIPAA, and professional accountability, as it falsifies who accessed and documented patient information. The keyword "most appropriate action" directs the medical assistant to a solution that addresses the gravity of the situation. While reminding the colleague is a good first step, the breach is significant enough that it warrants reporting to a supervisor to ensure proper training, security measures, and accountability are enforced. Ignoring it or assisting would be irresponsible and potentially compromise patient data integrity and legal compliance. Always prioritize patient privacy and data security by reporting any breaches of EHR access protocols. Question 12. A medical assistant is preparing to administer an influenza vaccination to a patient. After reconstituting the vaccine, the medical assistant realizes they were distracted and are unsure of the exact time the vaccine was reconstituted. What is the most appropriate action? A. Administer the vaccine immediately, assuming it was recent. B. Ask a colleague if they recall the reconstitution time. C. Discard the vaccine and prepare a new dose. D. Reconstitute another vial and label it clearly. Answer C. Discard the vaccine and prepare a new dose. This question assesses medication safety and adherence to protocols, especially concerning time-sensitive preparations. The keyword "unsure of the exact time" is critical because reconstituted vaccines often have a limited stability period, and administering a dose outside this window could reduce its effectiveness or even pose a risk. When there is any doubt about the integrity or preparation time of a medication, the safest and most appropriate action is to discard it and prepare a fresh dose. Guessing or relying on a colleague's potentially inaccurate memory is not acceptable in medication administration. Patient safety is paramount, and any uncertainty regarding medication viability requires starting over to ensure proper care. Question 13. A medical assistant is preparing to perform a venipuncture on a patient with visible petechiae. What could this finding indicate, and what action should the medical assistant consider? A. Normal skin finding, proceed with venipuncture as usual. B. Allergic reaction, administer antihistamine prior to draw. C. Coagulation disorder, apply pressure for an extended duration after draw. D. Local infection, choose an alternative site far from the petechiae. Answer C. Coagulation disorder, apply pressure for an extended duration after draw. This question tests the medical assistant's ability to interpret clinical signs and modify procedures accordingly for patient safety. Petechiae are small, pinpoint, reddish-purple spots on the skin, which can indicate fragile capillaries or a platelet deficiency, suggesting a potential coagulation disorder. The keyword "visible petechiae" is a warning sign. While venipuncture may still be necessary, the increased risk of prolonged bleeding or bruising means the medical assistant should anticipate this and apply pressure for a longer duration after the blood draw to prevent excessive bleeding or hematoma formation. It is not an allergic reaction, infection, or a normal finding that can be ignored in this context. Always be mindful of subtle skin signs that may indicate underlying conditions affecting procedures like venipuncture. Question 14. A medical assistant is reviewing a patient's laboratory results and notes an elevated creatinine level. Which of the following organs is primarily associated with creatinine metabolism and excretion, and therefore potentially impacted by this finding? A. Liver. B. Heart. C. Kidneys. D. Lungs. Answer C. Kidneys. This question tests foundational knowledge of basic laboratory values and their association with specific organ function. Creatinine is a waste product produced by muscle metabolism, and healthy kidneys filter it from the blood and excrete it in the urine. The keyword elevated creatinine level directly points to impaired kidney function because when the kidneys are not working efficiently, creatinine builds up in the blood. Therefore, an elevated creatinine level is a key indicator of kidney dysfunction. The liver, heart, and lungs have different primary roles and are not directly responsible for creatinine metabolism or excretion. Understanding these basic connections helps medical assistants recognize potential health concerns from lab reports. Question 15. A medical assistant is providing discharge instructions for a patient who just underwent a minor surgical procedure and was prescribed an antibiotic. The patient states, "I usually feel better after a few days, so I'll probably stop taking it then." What is the most important instruction the medical assistant should reinforce? A. You should only take the antibiotic if your symptoms return. B. Make sure to take the full course of the antibiotic, even if you feel better. C. Take an over-the-counter pain reliever if you experience discomfort. D. You can share any leftover medication with family members who get sick. Answer B. Make sure to take the full course of the antibiotic, even if you feel better. This question assesses critical patient education related to medication adherence and public health. The patient's statement, "I'll probably stop taking it then," highlights a common misconception that can lead to significant problems. The keyword "most important instruction" guides the medical assistant to address the core issue of incomplete antibiotic therapy. It is crucial to reinforce that the patient must complete the entire prescribed course of antibiotics, even if symptoms improve, to ensure all bacteria are eliminated and to prevent antibiotic resistance. Stopping early can lead to a relapse of the infection and contribute to the development of drug-resistant bacteria. Never encourage patients to stop antibiotics early or share them, as this has serious public health consequences. Question 16. A medical assistant is updating a patient's problem list in the EHR. The patient reports having pain in my belly button area, but only when I cough. This description is most consistent with a symptom of which of the following? A. Cholecystitis. B. Inguinal hernia. C. Umbilical hernia. D. Appendicitis. Answer C. Umbilical hernia. This question tests the medical assistant's ability to connect patient symptoms to likely medical conditions, requiring a basic understanding of common pathologies. The key phrases are pain in my belly button area and only when I cough. An umbilical hernia occurs when abdominal contents protrude through a weakened area around the navel, and this protrusion, or the associated pain, often becomes more noticeable or worsens with increased intra-abdominal pressure, such as from coughing or straining. Cholecystitis involves the gallbladder, upper right abdomen, an inguinal hernia is in the groin, and appendicitis typically causes pain that starts around the navel but then localizes to the lower right abdomen, usually becoming constant. Being able to recognize typical symptom patterns helps anticipate provider needs and document accurately. Question 17. A medical assistant is preparing to perform a spirometry test. Which of the following instructions is most critical for ensuring accurate results? A. Take a small, shallow breath before blowing into the machine. B. Perform a forced, maximum exhalation until your lungs feel empty. C. Breathe normally into the mouthpiece for 30 seconds. D. Hold your breath for as long as possible after inhaling. Answer B. Perform a forced, maximum exhalation until your lungs feel empty. This question assesses the medical assistant's understanding of specific diagnostic procedure requirements. Spirometry measures lung function, specifically how much and how quickly a person can move air in and out of their lungs. The keyword most critical for ensuring accurate results points to the essential maneuver for this test. To obtain accurate spirometry readings, the patient must take a deep breath in and then exhale forcefully and completely, emptying their lungs as much as possible. Shallow breaths, normal breathing, or breath holding would not yield the necessary measurements of forced vital capacity, FVC, and forced expiratory volume in 1 second, FEV1. Proper instruction is key to valid test results. Question 18. A medical assistant is asked to dispose of sharps. According to OSHA guidelines, what is the correct disposal method for a contaminated needle used to administer an injection? A. Recap the needle and place it in a biohazard bag. B. Place the uncapped needle in a puncture-resistant container. C. Break the needle off the syringe before disposing in a regular trash can. D. Dispose of the entire syringe and needle in a general waste receptacle. Answer: B. Place the uncapped needle in a puncture-resistant container. This question tests knowledge of infection control and safety regulations, specifically OSHA guidelines for sharps disposal. The keywords contaminated needle and OSHA guidelines indicate the need for strict adherence to safety protocols. The correct and safest method for disposing of a contaminated needle is to immediately place the uncapped needle and attached syringe into a designated, puncture-resistant sharps container. Recapping needles is strictly prohibited due to the high risk of needle stick injury, and disposing of sharps in general waste is highly dangerous and illegal. Always prioritize safety by using proper sharps disposal methods to prevent accidental needle sticks and reduce the risk of bloodborne pathogen transmission. Question 19. A medical assistant is educating a patient about a new prescription for an antidepressant. The patient expresses concern about taking a medication long-term. Which of the following responses is most appropriate for the medical assistant to provide? A. You can stop taking it as soon as you feel better to avoid dependency. B. These medications often take several weeks to become fully effective, so consistent use is important. C. Don't worry, many people feel better right away, and you might too. D. You should try natural remedies first, as they have fewer side effects. Answer: B. These medications often take several weeks to become fully effective, so consistent use is important. This question assesses effective patient education and communication skills regarding medication. The patient's concern about taking a medication long-term is an important clue, and the keyword most appropriate response requires an answer that is accurate, supportive, and addresses common patient concerns about antidepressants. Many antidepressants take several weeks to reach their full therapeutic effect, and consistent daily use is crucial for their efficacy. Informing the patient about this delayed onset helps manage expectations and encourages adherence, preventing them from prematurely stopping the medication due to perceived ineffectiveness or a desire to avoid long-term use. Counseling them to stop early, suggesting immediate effects, or recommending natural remedies are inappropriate and potentially harmful. Question 20. A medical assistant is asked to provide a copy of a patient's medical records to a specialist. The patient has provided a signed authorization for release of information. Which of the following pieces of information is typically not included in a routine release of medical records without specific, additional consent? A. Diagnosis and treatment plans. B. Physician's progress notes. C. HIV test results. D. Laboratory results. Answer: C. HIV test results. This question tests knowledge of patient privacy and specific protected health information, PHI, under HIPAA, particularly concerning sensitive information. While a general signed authorization allows for the release of routine medical information, certain types of sensitive information, such as HIV test results, substance abuse treatment records, and psychotherapy notes, often require specific, additional consent beyond a general release form. The keyword "not included" in a routine release highlights this distinction. This extra layer of protection ensures patient privacy for highly personal and potentially stigmatizing health conditions. Always double-check consent forms for specific authorizations when releasing sensitive health information. Question 21. A medical assistant is performing a Holter monitor application. Which of the following actions is most critical for ensuring accurate data collection? A. Instruct the patient to avoid bathing or showering during the monitoring period. B. Advise the patient to limit physical activity to prevent lead dislodgement. C. Tell the patient to record only significant symptoms in the diary. D. Ensure electrodes are placed directly over bony prominences for stability. Answer: A. Instruct the patient to avoid bathing or showering during the monitoring period. This question assesses knowledge of specific patient preparation and care for diagnostic procedures. A Holter monitor continuously records cardiac activity, typically for 24 to 48 hours. The keyword "most critical for ensuring accurate data collection" points to instructions that directly impact the device's function. Avoiding bathing or showering is crucial because water can damage the monitor, dislodge electrodes, and interfere with the electrical signals, leading to incomplete or inaccurate recordings. While limiting activity and recording symptoms are important, maintaining the integrity of the electrodes and the device by keeping it dry is paramount for continuous, accurate data. Always emphasize the importance of keeping the monitor and electrodes dry throughout the entire monitoring period. Question 22. A patient calls the office reporting severe chest pain, shortness of breath, and radiating pain down their left arm. The medical assistant recognizes these as signs of a potential myocardial infarction. What is the immediate and most appropriate action? A. Advise the patient to take 2 aspirins and call back if symptoms worsen. B. Instruct the patient to drive to the nearest emergency department. C. Tell the patient to lie down and try to relax, then call the physician for advice. D. Instruct the patient to call emergency services, 911, immediately. Answer: D. Instruct the patient to call emergency services, 911, immediately. This question tests the medical assistant's ability to triage critical symptoms and guide patients in emergencies. The symptoms described, severe chest pain, shortness of breath, and radiating pain down their left arm, are classic indicators of a potential myocardial infarction, heart attack, which is a life-threatening emergency. The keyword "immediate" and "most appropriate action" requires prioritizing the quickest access to advanced medical care. In such a critical situation, directing the patient to call emergency services, 911, ensures rapid transport and access to pre-hospital advanced life support, which is far safer and faster than self-transport or waiting for a physician's call back. Always advise patients with symptoms of a heart attack or stroke to call emergency services directly. Question 23. A medical assistant is performing an EKG on a patient and notices significant artifact on several leads. Which of the following is the most likely cause of somatic tremor artifact? A. Patient is wearing excessive jewelry. B. Electrodes are expired or poorly adhered. C. Patient is cold, nervous, or experiencing muscle contractions. D. Nearby electrical equipment interference. Answer: C. Patient is cold, nervous, or experiencing muscle contractions. This question assesses the medical assistant's ability to troubleshoot common EKG artifacts. The term somatic tremor artifact specifically refers to muscle movement interference on the EKG tracing. The keyword "most likely cause" directs to the primary reason for this type of artifact. Somatic tremors are caused by involuntary or voluntary muscle contractions, often due to the patient being cold, nervous, uncomfortable, or having conditions like Parkinson's disease. Expired electrodes cause wandering baseline or baseline drift, while electrical interference causes AC interference, and jewelry might cause some interference but is not the primary cause of muscle tremor. Always ensure the patient is warm, comfortable, and relaxed to minimize somatic tremor artifact during an EKG. Question 24. A medical assistant needs to prepare a sterile field for a minor surgical procedure. After opening the sterile package, which of the following actions constitutes a break-in sterile technique? A. Placing the sterile field on a clean, dry surface. B. Touching the outer 1-inch border of the sterile field with gloved hands. C. Reaching over the sterile field with ungloved hands. D. Adding sterile items to the field without dropping them on the border. Answer: C. Reaching over the sterile field with ungloved hands. This question tests critical knowledge of maintaining a sterile field, a cornerstone of infection control. The keyword break-in sterile technique identifies actions that compromise the sterility. Reaching over a sterile field with ungloved hands, or any non-sterile object, introduces potential contaminants from the air, skin, or clothing into the sterile area. The outer 1-inch border is considered non-sterile, so touching it with sterile gloves is acceptable. Placing the field on a clean, dry surface and adding items correctly are appropriate. Always remember that anything non-sterile crossing or touching a sterile field compromises its integrity, requiring the field to be reset. Question 25. A patient presents with symptoms of a urinary tract infection, UTI. The medical assistant collects a clean catch midstream urine sample. What is the most critical instruction for the medical assistant to give the patient to ensure an uncontaminated specimen? A. Fill the cup completely to get enough urine for the test. B. Cleanse the genital area thoroughly with the provided wipes before urinating. C. Collect the very first portion of urine that comes out. D. Refrigerate the specimen at home if you cannot bring it in immediately. Answer: B. Cleanse the genital area thoroughly with the provided wipes before urinating. This question assesses knowledge of proper specimen collection techniques, specifically for a clean catch urine sample. The keyword most critical instruction highlights the action essential for preventing contamination of the sample. For a clean catch midstream urine sample, thorough cleansing of the genital area before voiding is crucial to remove bacteria from the skin that could otherwise contaminate the urine specimen. Collecting the first portion or filling the cup completely are less critical than proper cleansing, and refrigeration is for preservation after collection, not contamination prevention during collection. Proper cleansing ensures that the sample accurately reflects the urine within the bladder, not surface contamination. Question 26. A medical assistant is reconciling a patient's medication list and discovers a discrepancy between the patient's reported medications and the medications listed in the EHR. Which of the following is the most appropriate initial action? A. Update the EHR with the patient's reported medications immediately. B. Instruct the patient to only take the medications listed in the EHR. C. Ask the patient clarifying questions about the discrepancies and verify with the prescribing provider if necessary. D. Document the discrepancy and assume the patient is misinformed. Answer: C. Ask the patient clarifying questions about the discrepancies and verify with the prescribing provider if necessary. This question tests critical thinking and patient safety protocols regarding medication reconciliation. A discrepancy between reported medications and the EHR is a serious patient safety concern. The keyword most appropriate initial action requires a thorough and investigative approach. The medical assistant should first ask clarifying questions to understand the discrepancy, e.g., new prescriptions, discontinued medications, over-the-counter drugs, or herbal supplements. If the discrepancy remains unclear or poses a safety risk, it is essential to verify with the prescribing provider. Simply updating the EHR or assuming the patient is wrong without verification could lead to medication errors. Always investigate medication discrepancies thoroughly to ensure patient safety. Question 27. A medical assistant is educating a patient about a new diagnosis of hypertension. Which of the following lifestyle modifications should the medical assistant emphasize as most effective for initial management? A. Restricting all fluid intake. B. Increasing intake of processed foods. C. Regular physical activity and a low-sodium diet. D. Avoiding all medications and relying solely on diet. Answer: C. Regular physical activity and a low-sodium diet. This question assesses knowledge of chronic disease management and effective patient education. The keyword most effective for initial management focuses on primary interventions for hypertension. Regular physical activity and a low-sodium diet are foundational and highly effective lifestyle modifications recommended for managing hypertension, often as initial steps before or alongside medication. Restricting all fluids is incorrect and potentially harmful. Increasing processed foods would worsen hypertension, and completely avoiding medications without a doctor's guidance is dangerous. Emphasizing these evidence-based lifestyle changes empowers patients to take an active role in managing their condition. Question 28. A medical assistant is sterilizing instruments using an autoclave. After a sterilization cycle, the medical assistant notices that the indicator on one of the instrument packs has not changed color. What is the most appropriate action? A. Assume the instruments are sterile and proceed with storage. B. Reprocess the entire load of instruments. C. Remove the pack with the unchanged indicator and use the other packs. D. Place the pack with the unchanged indicator back into the autoclave for another cycle. Answer: B. Reprocess the entire load of instruments. This question tests critical knowledge of infection control and sterilization quality assurance. The unchanged indicator on an instrument pack is a crucial sign that the sterilization process may have failed for that specific pack, and potentially the entire load. The keyword most appropriate action focuses on patient safety. If even one indicator fails, it casts doubt on the sterility of the entire load, as the failure could be due to an autoclave malfunction or improper loading. Therefore, the safest and most appropriate action is to consider the entire load non-sterile and reprocess all instruments to ensure patient safety. Never assume sterility when an indicator fails. Question 29. A medical assistant is performing a venipuncture and observes the patient's arm swelling rapidly at the site of injection, along with pain. What is the immediate and most appropriate action? A. Apply a tourniquet above the swelling. B. Withdraw the needle, apply pressure, and apply a cold pack. C. Push the needle in further to find the vein. D. Continue the draw, but adjust the needle angle slightly. Answer: B. Withdraw the needle, apply pressure, and apply a cold pack. This question assesses critical incident response during venipuncture. The symptoms of arm swelling rapidly at the site of injection, along with pain, strongly indicate a hematoma formation, meaning blood is leaking into the surrounding tissues, likely due to the needle going through the vein or not being fully in the vein. The keyword immediate and most appropriate action demands a quick and corrective response. The immediate action is to withdraw the needle to stop the blood leakage, apply direct pressure to the site to minimize the hematoma, and then apply a cold pack to help reduce swelling and pain. Continuing the draw or pushing the needle further would worsen the hematoma. Always prioritize patient comfort and safety by stopping the procedure if a hematoma forms. Question 30. A medical assistant is discussing advanced directives with a patient. Which of the following documents specifically designates an agent to make healthcare decisions on behalf of the patient if they become incapacitated? A. Living will. B. Do not resuscitate, DNR, order. C. Durable power of attorney for healthcare. D. Organ donor card. Answer: C. Durable power of attorney for healthcare. This question assesses understanding of different types of advanced directives and their specific functions. The keyword designates an agent to make healthcare decisions is the key differentiator. A durable power of attorney for healthcare, also known as a healthcare proxy or medical power of attorney, is the legal document that allows an individual to appoint a specific person, the agent or proxy, to make medical decisions for them if they become unable to do so. A living will expresses preferences for medical treatment, a DNR order dictates wishes regarding resuscitation, and an organ donor card expresses intent for organ donation, but none of these designate a decision-making agent. Understanding these distinctions is crucial for patient advocacy and respecting patient autonomy. Question 31. A medical assistant is preparing a patient for a sigmoidoscopy. Which of the following positions is typically used for this procedure? A. Supine position. B. Lithotomy position. C. Trendelenburg position. D. Sims position. Answer: D. Sims position. This question tests knowledge of patient positioning for specific diagnostic procedures. A sigmoidoscopy is an examination of the lower part of the colon. The keyword typically used points to the standard positioning. The Sims position, where the patient lies on their left side with the left arm behind the back and the right knee and thigh drawn up toward the chest, is commonly used for rectal and sigmoidoscopic examinations as it provides optimal access and patient comfort. The supine position is flat on the back, lithotomy is on the back with feet in stirrups, and Trendelenburg is flat on the back with the head lower than the feet, none of which are ideal for this procedure. Knowing the correct patient position is essential for proper procedure execution. Question 32. A medical assistant is performing an EKG on a patient with dextrocardia. How should the medical assistant modify the standard EKG lead placement? A. Place all limb leads on the opposite limbs. B. Reverse the V1 and V2 chest lead placements. C. Place all precordial, chest, leads on the right side of the chest in a mirror image. D. Use only the limb leads and omit the chest leads. Answer: C. Place all precordial, chest, leads on the right side of the chest in a mirror image. This question assesses advanced EKG knowledge, specifically for an uncommon anatomical variation. Dextrocardia is a rare condition where the heart is located on the right side of the chest instead of the left. The keyword dextrocardia is the critical clue. To accurately record cardiac electrical activity in a patient with dextrocardia, all precordial, chest, leads, V1 V6, must be placed on the right side of the chest, mirroring the standard left-sided placement. Limb leads typically remain in their standard positions. Reversing only V1 and V2 or omitting chest leads would result in an inaccurate or incomplete EKG. Recognizing this specialized placement ensures accurate diagnosis for patients with this condition. Question 33. A medical assistant is providing instructions to a patient about collecting a 24-hour urine specimen. Which of the following instructions is most important to ensure accurate results? A. Discard the very first urine sample of the 24-hour period. B. Add a preservative to the collection container at the beginning of the collection. C. Keep the urine collection container at room temperature throughout the 24 hours. D. Collect every urine void during the 24-hour period, including the last one. Answer: D. Collect every urine void during the 24-hour period, including the last one. This question tests precise knowledge of laboratory specimen collection protocols. A 24-hour urine specimen is collected to measure the excretion of substances over an entire day. The keyword most important to ensure accurate results emphasizes the need for a complete collection. It is critical to collect every urine void during the designated 24-hour period, starting after the first morning void, which is discarded, and ending with the final void at the 24-hour mark. Missing any void would lead to an inaccurate underestimation of the substance being measured. While refrigeration and sometimes preservatives are used, complete collection is paramount for quantitative accuracy. Question 34. A medical assistant is performing a venipuncture on an elderly patient with fragile veins. Which of the following modifications should the medical assistant consider to minimize the risk of bruising or hematoma? A. Use a larger gauge needle, e.g., 18 gauge. B. Apply the tourniquet more tightly than usual. C. Use a smaller gauge needle, e.g., 23 to 25 gauge, and apply less aggressive pressure with the tourniquet. D. Perform the venipuncture on the dorsal side of the hand exclusively. Answer: C. Use a smaller gauge needle, e.g., 23 to 25 gauge, and apply less aggressive pressure with the tourniquet. This question assesses adaptation of venipuncture technique for specific patient populations. The keywords elderly patient with fragile veins highlight the need for careful modification to prevent complications. To minimize trauma and the risk of bruising or hematoma in patients with fragile veins, it is best to use a smaller gauge needle, e.g., 23 to 25 gauge butterfly needle, to reduce vein damage. Additionally, applying less aggressive pressure with the tourniquet or even no tourniquet at all, if veins are sufficiently prominent, can prevent unnecessary stress on fragile vessels. Using a larger needle or a tighter tourniquet would increase the risk of complications. Always adapt your technique to the patient's specific needs, especially for those with fragile veins. Question 35. A medical assistant is preparing to perform an audiometry test. Which of the following actions should the medical assistant take to ensure a valid screening? A. Instruct the patient to respond only to loud, clear tones. B. Ensure the test is conducted in a quiet, sound-attenuating environment. C. Use only bone conduction for all initial screenings. D. Provide visual cues to the patient when a tone is presented. Answer: B. Ensure the test is conducted in a quiet, sound-attenuating environment. This question tests knowledge of proper procedure for a specific diagnostic test. Audiometry measures a patient's hearing acuity. The keyword "ensure a valid screening" highlights the importance of creating optimal testing conditions. For accurate audiometry results, it is absolutely crucial to conduct the test in a quiet, sound-attenuating environment to prevent external noises from interfering with the patient's ability to hear the presented tones. Responding only to loud tones, using only bone conduction, which is a specific part of a full audiometry, not a screening standard, or providing visual cues would compromise the validity of the air conduction test. A quiet environment is fundamental for reliable hearing assessment. Question 36. A medical assistant is preparing a patient for a Papanicolaou (PAP) test. Which of the following instructions should the medical assistant provide regarding pre-test preparation? A. You should douche the morning of the test to ensure cleanliness. B. Avoid intercourse, douching, and vaginal medications for 24 to 48 hours prior to the test. C. You can have the test performed while actively menstruating. D. It is not necessary to inform the provider if you are pregnant. Answer: B. Avoid intercourse, douching, and vaginal medications for 24 to 48 hours prior to the test. This question assesses knowledge of patient preparation for a gynecological procedure. A PAP test screens for cervical cell abnormalities. The keyword pre-test preparation emphasizes specific patient actions needed for accurate results. To ensure the accuracy of the PAP test, patients should be instructed to avoid douching, vaginal medications, and intercourse for 24 to 48 hours prior to the test, as these can wash away or obscure abnormal cells. Actively menstruating can also interfere with the sample, and it is always necessary to inform the provider of pregnancy status. Proper preparation is vital for obtaining a quality specimen and reliable diagnostic results. Question 37. A medical assistant receives an order for a patient to receive 500 milligrams of a medication that is supplied as 250 milligrams tablets. How many tablets should the medical assistant administer? A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Answer: B. 2 tablets. This question tests basic dosage calculation, a fundamental skill for medical assistants. The concept being tested is converting a prescribed dose into the correct number of tablets based on the available strength. If the order is for 500 milligrams and each tablet contains 250 milligrams, the medical assistant needs to divide the ordered dose by the strength per tablet, 500 milligrams/250 milligrams per tablet. This calculation yields 2 tablets. Accurate dosage calculation is critical for patient safety and medication administration. Always double-check your math to ensure the patient receives the correct dose. Question 38. A medical assistant is performing a venipuncture and the patient experiences syncope, fainting. What is the immediate and most appropriate action? A. Continue the venipuncture quickly to finish the draw. B. Have the patient sit up and offer them water. C. Remove the needle immediately, lay the patient down, and elevate their feet. D. Apply a warm compress to the patient's forehead. Answer: C. Remove the needle immediately, lay the patient down, and elevate their feet. This question assesses the medical assistant's response to an acute patient emergency during a common procedure. The keywords "patient experiences syncope, fainting" clearly indicate a sudden loss of consciousness due to temporary reduction in blood flow to the brain. The immediate and most appropriate action prioritizes patient safety. The needle must be removed immediately to prevent injury, and the patient should be safely lowered to a supine position, lying flat, with their feet elevated to promote blood flow back to the brain. Having them sit up could worsen the syncope, and a warm compress is not the immediate priority. Patient safety is paramount, and a rapid, correct response to syncope is crucial. Question 39. A medical assistant is documenting a patient's vital signs and notes a blood pressure of 142/90 mmHg. According to current guidelines, this reading falls into which category? A. Normal blood pressure. B. Prehypertension. C. Stage 1 hypertension. D. Stage 2 hypertension. Answer: C. Stage 1 hypertension. This question tests knowledge of current clinical guidelines for classifying blood pressure readings, which is essential for patient education and risk assessment. The blood pressure reading is 142/90 mmHg. According to the most recent American Heart Association/American College of Cardiology, AHA/ACC, guidelines, stage 1 hypertension is defined as a systolic pressure between 130 to 139 millimeters of mercury or a diastolic pressure between 80 to 89 millimeters of mercury. Since the patient's diastolic pressure, 90 millimeters of mercury, is greater than or equal to 90 millimeters of mercury, it falls into the stage 1 hypertension category. A reading of 142/90 is above prehypertension, 120 to 129 systolic and less than 80 diastolic, and below stage 2 hypertension, greater than or equal to 140 systolic or greater than or equal to 90 diastolic. Keeping up to date with these guidelines helps provide accurate information to patients. Question 40. A medical assistant is preparing an immunization for a 4-year-old child. The order specifies a subcutaneous injection. Which of the following sites and needle sizes is most appropriate? A. Deltoid muscle, 23 gauge, 1-inch needle. B. Vastus lateralis muscle, 21 gauge, 1.5-inch needle. C. Outer aspect of the upper arm, 25 gauge, 5/8 inch needle. D. Dorsogluteal muscle, 22 gauge, 1 inch needle. Answer: C. Outer aspect of the upper arm, 25 gauge, 5/8 inch needle. This question assesses precise knowledge of injection techniques, specific to administration route, patient age, and site selection. The keywords are 4-year-old child and subcutaneous injection. For subcutaneous injections in children, the outer aspect of the upper arm or the thigh is generally preferred due to sufficient subcutaneous tissue. A 25 gauge, 5/8 inch needle is typically appropriate for subcutaneous injections in children as it is fine enough to minimize discomfort and short enough to deposit the medication into the subcutaneous layer without reaching the muscle. Deltoid and vastus lateralis are intramuscular sites, and the dorsogluteal is not recommended for children under 3 due to sciatic nerve risk. Correct needle and site selection are paramount for effective and safe medication delivery. Question 41. A medical assistant is performing a capillary puncture on an adult patient for a glucose test. The patient's hands are cold. Which of the following actions should the medical assistant take to improve blood flow before the puncture? A. Apply an ice pack to the finger. B. Have the patient vigorously rub their hands together. C. Warm the patient's hand with a warm compress or by having them clench a fist. D. Prick multiple fingers until adequate blood flow is achieved. Answer: C. Warm the patient's hand with a warm compress or by having them clench a fist. This question tests practical problem-solving skills in specimen collection. When a patient's hands are cold, blood flow to the capillaries can be reduced, making it difficult to obtain a sufficient blood sample for a capillary puncture. The keyword "improve blood flow" guides the medical assistant's action. Warming the hand with a warm compress or having the patient clench their fist helps to increase circulation and bring blood to the surface, facilitating an easier and more successful puncture. Applying ice would further restrict blood flow, rubbing hands vigorously might not be enough, and pricking multiple fingers causes unnecessary discomfort. Preparing the site properly enhances patient comfort and procedure success. Question 42. A medical assistant is reviewing a patient's medical record for proper consent prior to a surgical procedure. Which of the following elements is a mandatory component of informed consent? A. A detailed explanation of all potential financial costs. B. The patient's current marital status. C. The physician's personal guarantee of a successful outcome. D. A discussion of alternative treatments and their risks/benefits. Answer: D. A discussion of alternative treatments and their risks/benefits. This question assesses knowledge of ethical and legal principles surrounding patient consent. Informed consent is a cornerstone of patient autonomy, ensuring patients understand and agree to their medical care. The keyword "mandatory component" highlights essential requirements. A critical part of informed consent is that the patient must be informed about the proposed treatment, its risks and benefits, and any reasonable alternative treatments, along with their associated risks and benefits. Financial costs, marital status, or a physician's guarantee, which is unethical, are not core components of the medical informed consent process. Ensuring patients have all relevant information before making a decision is a fundamental ethical and legal obligation. Question 43. A medical assistant is preparing a patient for a tuberculosis, TB, skin test, Mantoux test. Which of the following is the correct angle and technique for administering this injection? A. 90-degree angle, into the muscle. B. 45-degree angle, into the subcutaneous tissue. C. 15-degree angle, with the bevel up, forming a wheel. D. 25-degree angle, into the dermis, without a wheel. Answer: C. 15-degree angle, with the bevel up, forming a wheel. This question tests precise knowledge of injection techniques for specific diagnostic tests. A Mantoux TB skin test is an intradermal injection, meaning the medication, PPD, is injected into the dermal layer of the skin. The correct technique for an intradermal injection is to insert the needle at a 10 to 15 degree angle with the bevel facing up. This shallow angle allows the medication to be injected just under the epidermis, creating a distinct, palpable wheal, small bump, as the solution is absorbed. Injecting at 90 degrees is intramuscular, 45 degrees is subcutaneous, and without a wheal indicates incorrect depth. Precise technique is essential for the accuracy of the TB skin test. Question 44. A medical assistant is assisting a physician with a punch biopsy. After the procedure, the medical assistant is responsible for properly labeling the specimen. Which of the following information is most critical to include on the specimen label? A. Patient's room number. B. Date and time of collection. C. Physician's name and signature. D. Patient's insurance provider. Answer: B. Date and time of collection. This question assesses critical knowledge of specimen labeling for accurate laboratory processing and patient identification. The keyword "most critical" emphasizes the data absolutely necessary for a valid specimen. The date and time of collection are crucial for tracking the specimen's journey, ensuring timely processing, and correlating laboratory results with the patient's clinical state. While patient identifiers, name, DOB, are paramount and always included, the options provided focus on other data points. Physician's information is for the requisition, not the specimen label itself, and insurance is for billing. Accurate date and time ensure the integrity and correct interpretation of diagnostic tests. Question 45. A medical assistant is performing a urinalysis using a reagent strip. The strip indicates a positive result for nitrites. What does a positive nitrite test primarily suggest? A. Presence of glucose in the urine. B. Kidney stone formation. C. Bacterial infection in the urinary tract. D. Liver dysfunction. Answer: C. Bacterial infection in the urinary tract. This question tests knowledge of specific urinalysis findings and their clinical significance. The keyword "positive result for nitrites" is the direct clue. Nitrites are produced when certain bacteria, commonly found in urinary tract infections, UTIs, convert nitrates, normally present in urine, into nitrites. Therefore, a positive nitrite test is a strong indicator of a bacterial infection in the urinary tract. Glucose in the urine suggests diabetes, kidney stones are often indicated by hematuria or crystals, and liver dysfunction might show bilirubin or urobilinogen, but nitrites specifically point to bacterial presence. Understanding these indicators helps in preliminary diagnosis. Question 46. A medical assistant is educating a patient about proper use of a metered dose inhaler, MDI. Which of the following instructions is most important to ensure effective delivery of the medication to the lungs? A. Inhale rapidly and shallowly as you press the canister. B. Exhale completely, then press the canister and inhale slowly and deeply. C. Breathe in through your nose while pressing the canister. D. Press the canister, then take several quick breaths. Answer: B. Exhale completely, then press the canister and inhale slowly and deeply. This question assesses critical patient education for a common medication delivery device. For effective use of a metered dose inhaler, MDI, the most important instruction is to exhale completely first to empty the lungs, then press the canister while simultaneously inhaling slowly and deeply through the mouth. This technique allows the medication to reach deep into the lungs. Inhaling rapidly or shallowly, breathing through the nose, or taking quick breaths would result in less medication reaching the airways and more depositing in the mouth or throat, reducing effectiveness. Proper technique is crucial for managing respiratory conditions. Question 47. A medical assistant observes a patient exhibiting signs of an anaphylactic reaction after receiving an injection. What is the first and most crucial step the medical assistant should take? A. Administer oral antihistamine. B. Document the reaction in the patient's chart. C. Activate emergency medical services, call 911/rapid response, and prepare to administer epinephrine. D. Place the patient in a Trendelenburg position. Answer: C. Activate emergency medical services, call 911/rapid response, and prepare to administer epinephrine. This question tests the medical assistant's immediate response to a life-threatening emergency. Anaphylaxis is a severe, rapidly progressing allergic reaction that can be fatal if not treated immediately. The keywords anaphylactic reaction and first and most crucial step demand immediate, life-saving intervention. Activating emergency services, like calling 911 or a rapid response team, and preparing to administer epinephrine, the primary treatment, are the top priorities. Oral antihistamines are too slow, documentation comes after ensuring patient safety, and while positioning can help, the priority is medication and emergency response. Always prioritize calling for help and administering epinephrine for anaphylaxis. Question 48. A medical assistant is performing a venipuncture on a patient who has a mastectomy on the left side. Which of the following sites should the medical assistant avoid for blood collection? A. The right antecubital fossa. B. The left arm. C. The right hand. D. The right femoral vein. Answer: B. The left arm. This question assesses crucial patient safety considerations for venipuncture in specific clinical situations. A mastectomy, especially with lymph node dissection, can lead to lymphedema, swelling, and increased risk of infection or complications if venipuncture is performed on the affected side due to compromised lymphatic drainage. The keyword mastectomy on the left side means the medical assistant should avoid the entire left arm for blood collection. While the right antecubital fossa or right hand are generally safe, using the left arm carries a risk. Always choose the unaffected limb for venipuncture in patients with a history of mastectomy. Question 49. A medical assistant is performing wound care and notes purulent drainage from the wound. What does purulent drainage indicate? A. Clear, watery fluid, common in early healing. B. Thin, pinkish fluid, common in new wounds. C. Thick, opaque, often yellow, green, or brown fluid, indicating infection. D. Bloody drainage, suggesting fresh bleeding. Answer: C. Thick, opaque, often yellow, green, or brown fluid, indicating infection. This question tests knowledge of wound assessment and terminology. The term purulent is a specific medical descriptor for wound drainage. Purulent drainage, also commonly known as pus, is typically thick, opaque, and often appears yellow, green, or brown, and it is a strong indicator of a bacterial infection in the wound. Clear/watery is serous, thin/pinkish is serosanguineous, and bloody is sanguineous. Recognizing purulent drainage is a critical assessment skill for the medical assistant, signaling the need for further evaluation and potential intervention. Question 50. A medical assistant is performing a fecal occult blood test, FOBT, using a guaiac card. Which of the following substances can cause a false positive result and should be avoided by the patient before the test? A. Vitamin C supplements. B. Red meat. C. Aspirin. D. Iron supplements. Answer: B. Red meat. This question tests specific patient preparation instructions for a diagnostic test. A fecal occult blood test, FOBT, particularly the guaiac-based test, detects hidden blood in the stool. The keyword false positive result refers to a test result that indicates a condition, blood, that is not actually present. Consuming red meat prior to a guaiac FOBT can lead to a false positive result because hemoglobin from the meat can react with the guaiac reagent, mimicking human blood. Patients are typically instructed to avoid red meat for several days before the test. Aspirin and other NSAIDs can cause actual GI bleeding, thus a true positive. Vitamin C can cause false negatives. Proper dietary restrictions are crucial for accurate FOBT results.